Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Big tummy and hepatomegaly relationship. Hepatomegaly means over large, that is extra large liver. When the liver is enlarged, it's called hepatomegaly. We have known that the big tummy is usually those days ascribed to good health and what have you. When you eat very well and overeat, then you gradually start seeing your tummy extended. But how do you know that this extension or this big tummy you are seeing is not a reflection of the enlarged liver that is usually happening because of overeating and overindulgence in alcohol drinks? Commonly, it is a common happening that you now have hepatomegaly, that is a large liver. This experience will cause certain discomfort, but in the beginning it's always transient, it is always insidious. You do not experience anything, and that is where the medical laboratory scientist comes into play, where they can now do certain enzymatic tests and DNA tests that will help unravel whether there is an onset of disease situation with the liver. The liver gets enlarged. Why? Because when you overeat, these things affect the liver by storing too much fats. The fats now swells the liver and makes it enlarge. That enlargement is what appears or diagnosed as the fatty liver disease or non-alcoholic fatty liver disease. Whereas if it's the alcohol too that is causing the fatty liver disease, now described as alcoholic liver disease or alcoholic fatty liver disease. So these terms are very important, but their importance is just for differentiation. But the health of the liver is what is most important. The liver is the largest organ in the body, and it can regenerate itself. So if the habit or lifestyle is curbed at that early stage, the liver returns back to the normal size, because in the beginning itself, it's the parts that's really swelling up the liver, making it enlarge, and thereby pushing the stomach, because the stomach lies under the liver more or less, and a large liver will also extend the stomach. The experience is such. But what are the laboratory investigations, and how do they detect it so early to stop this? It's not only the overeating and indulgence. Infections could also cause it. The hepatitis infection and even heart problems and could also affect the liver. All the organs of the body are not only interconnected in function, they are also connected in proximities. And that proximity tells you that what affects A could quickly affect B. So let's go on into the slide section, where I shall expose more knowledge as regards this relationship. The outline, objective, introduction, signs and symptoms and relationship, laboratory diagnosis, the conclusion and recommendations. The objective, to show the relationship between big tummy and hepatomegaly, to create more awareness of early detection of liver diseases through early laboratory diagnosis that will allow for the resolution of liver disease before it starts advancing in stages. The introduction. The liver is the largest solid organ in the body, weighing some 1.8 kg in men and 1.3 kg in women. It is located mainly in the upper right portion of your abdomen, under the diaphragm, and sits above the stomach, as seen in this diagram. A big tummy, abdominal distension, also called pot belly, and hepatomegaly are different. Yes, the pot belly is different from the hepatomegaly because a big tummy refers to general swelling of the abdominal cavity. It can be caused by many factors, including obesity, visceral fats, bloating, gas, pregnancy, or excess abdominal fluid, ascites, while hepatomegaly specifically refers to the swelling or enlargement of the liver organs itself, as I had earlier said in this video. Hepatomegaly can cause a big tummy, just like I have said earlier. Hepatomegaly, enlarged liver, a specific medical sign where the liver swells beyond its normal size of approximately 14 to 15 centimeters in adults. The liver is located in the right upper abdomen, so this enlargement usually causes pain or pressure in that area. Yes, going by this diagram, you will see the different stages of liver damages, how it progresses. The liver stays healthy from that period when you overeat and other problems affecting the liver. The fats are stored and becomes a fatty liver. It's either as a result of too much alcohol or other problems. Then the fiber, that's scar. When the scarring comes in, damages to the liver, you see the fibrosis stage. And then the cirrhosis is almost the end stage when the liver is totally damaged, and then cancer is another serious one. But at the early stages, you can still, especially at the fatty liver stage, if the lifestyle is changed, especially at that stage, the normal liver can result. The signs, symptoms, and relationship. Symptoms and feel big of the big tummy. The symptoms you see, the abdomen feels soft, just like it's fatty, or pains if it's gas that is filling there or fluid. With hepatomegaly, the abdomen may feel hard, tender, or firm to the touch, specifically under the right rib cage. It can cause a feeling of fullness after eating, fatigue, or yellowish skin jaundice, even where you have itching as well. The relationship, hepatomegaly often leads to a big tummy. When the liver grows too big, it pushes outward, causing the upper abdomen to appear swollen. Furthermore, advanced liver disease that causes hepatomegaly can also lead to ascites. That's fluid coming, where you now have fluid both in the liver and the stomach, which is the accumulation of fluid in the stomach, adding to the big tummy effect of the stomach. This summary table should help in distinguishing between the two. The location where the distension is. You can also look at the cause when you are talking of whether it's fat, gas, or the fatty liver disease, where it is hepatomegaly, infection, and cancer. The nature, whether it's physical appearance or clinical findings, that is the symptom itself when it is examined by the medical doctor. The key feeling of that, which I had all mentioned, and this is just a summary of it all. Laboratory diagnosis. The initial laboratory test for a suspected first injury to the liver focus on measuring the liver enzymes, then the coagulation capacity and synthetic function to assess damage and severity. The necessary tests often ordered together as a liver function test panel or comprehensive metabolic panel includes the key liver enzymes that checks for damage to the liver. If there is any damage to the liver, these enzymes will leak out. The most specific enzyme is alanine transaminase, and is specific for liver injury as it is found primarily in the liver. The next one is the aspartate aminotransferase, which is found in the liver, heart, and skeletal muscle. The alkaline phosphatase is also elevated when bile ducts are damaged or obstructed, often indicating a cholestatic component to the injury. Others are the GGT, the gamma glutamine transferase, used to confirm that elevated alkaline phosphatase is from the liver rather than bone. So when that is combined, you confirm that. The LDH is there. There is also the test, the coagulation test, just for how the functionality of the liver, how perfectly. You could also do the glucose test and the others. You could also confirm for infection where the hepatitis tests are done, viral hepatitis A, B, C, E, and then add the ultrasound, abdominal scan. So just check for the liver structure and check for obstruction or injury. Finally, recommendation and conclusion. The liver can regenerate itself. That's the beauty of the liver. And if it has not passed especially if it has not passed the irreversible stage, during the acute stage of liver disease, this is where you can really stop the onset. When it is still either fatty liver disease, a change in lifestyle is what is recommended. It will stop the degeneration process, that is progressing from stage 1, stage 2, stage 3 to the final stage 4 or cancer, especially those who overindulge in alcohol or high-calorie foods. Once that is where you are involved in, it's still okay when one is young, but as one grows up from 40 years upward, the complications becomes an issue. Chronic liver disease is most commonly cirrhosis. When ascites develop as scarring advances, the ascites we talk of the water pool, even in the stomach, making it swell because all the porta are blocked. Where the hepatitis tests are positive, but no damage done or discovered due with the various enzymatic tests not showing any higher values than normal, then the carrier, the hepatitis positive patient is considered a carrier. So the person is best advised to live a lifestyle that will not encourage this sudden conversion to liver advanced stages disease, because or in the alternative, every 6 months check these enzymatic values, especially the damage or the functionality of the liver. And where it is beyond lifestyle changing, then one should consider visiting a pathologist or a gastroenterologist who can really manage the disease. More videos are on this channel. Just continue to patronize and the more